Mycle Brandy is walking and talking.
Hi, how are you today?
Good, how are you?
Good.
For a cause. On Valentine's Day, the California resident and four-time stroke survivor began trekking across America to call attention to a health crisis that affects nearly 800,000 Americans a year.
I'm trying to raise awareness that strokes kill, but they don't have to.
Which is what brings Brandy to Barnes Jewish Hospital on this busy summer morning. In every city along the way, Brandy has had just one request: to visit a local hospital with a dedicated, high-performing stroke unit.
One that saves lives. I want to see people that save lives. You here.
Nice to
All
meet
right,
you, sir.
nice to meet you too.
At Barnes Jewish, the group that greeted Brandy included stroke survivors and the health professionals who saved their lives.
I thank God, and I also thank Barnes for knowing what to do.
Darnell Marshall was undergoing kidney dialysis in Maryville, Illinois, when he realized his right side had suddenly become numb. The dialysis center was located near another hospital, but the clinic's nurses told the ambulance crew to take Marshall to Barnes.
They were ready for me when I got here. The ambulance had called ahead, and they were waiting on me. They took and administered the medicine, and in somewhere within about 10 minutes, it felt as if though I had feeling coming back in my right arm.
That miraculous outcome is actually standard procedure at Barnes. 3 years ago, the hospital's Stroke and Cerebrovascular Disease Center began implementing Get With The Guidelines, a national certification standards program coordinated by the American Stroke Association.
It assures that patients like Mycle and Darnell that come in through the emergency room department are treated with the best evidence-based medicine that gives them the best outcome.
All the nurses in the ED and the physicians, they have an acute stroke protocol they put into place once they know a possible stroke's coming in. And so things just go boom, 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 boom.
The hospital has already achieved the program's bronze and silver medal performance achievement awards.
We have one of the best outcomes in the country for hemorrhagic strokes. We have neurologists on call 24/7. We have therapists here 7 days a week. So the patient is seen by therapy their very first day that they're here.
They're not only using the program and doing the right thing, but they're doing it well.
Throughout the hospital, Barnes employees wear cards listing the 7 signs of stroke under their ID badges. That way, even non-medical staff can spot and act on a potential emergency. Barnes also has one of the best door-to-needle times in the nation when it comes to administering TPA, the life-saving, clot-busting stroke drug that Darnell Marshall received.
Usually the patients that get TPA here right now are door-to-needle time is 56 minutes.
That's crucial because under FDA guidelines for teaching hospitals like Barnes, TPA must be administered within 3 hours of the patient's first symptoms. So if Marshall had gone to a different, less specialized hospital first, he might have missed that window.
He could have ended up in a nursing home, still in a wheelchair.
Instead, Marshall walked out of Barnes just 5 days after his stroke. Patty Garavaglia had a similar outcome after suffering a hemorrhagic stroke at home.
I had to sign a waiver because actually I'm closer to another hospital, but I wouldn't let them take me anywhere but Barnes.
3 days later, Garavaglia was well enough to go home and begin living a healthier life.
Amazingly, how they can walk away with no residual after a stroke if the right care has been given to them.
Mycle Brandy turned his life around by quitting smoking and deciding to get fit after his 4th and hopefully final stroke. As he visited Barnes' neurosurgery intensive care units and neuronursing units, he offered hope to other stroke patients.
I have some stroke survivors that are actually going to walk with me the last 200 miles into Washington, D.C.
After that, Brandy will fly to Athens, Greece to walk in his 10th marathon.
There's hope after stroke that, things can and will get better.